I don't think anyone was ready for 2020.
This is where COVID was the deadliest.
Less than 1% of venture capital went to Black-run businesses.
Welcome to Your World by Bloomberg QuickTake. I'm Jennifer in New York.
And I'm Kurumi in Tokyo.
For the first time in 132 years, New York's legendary pastrami deli Katz's is offering outdoor dining.
It's just one of the ways dining has had to adapt due to COVID-19.
You know, like the country's sick, but I still like to eat, and I'm gonna have my pastrami sandwich no matter what.
It's definitely different because I'm used to seeing a bunch of people inside here. It's normally like a crowded place.
I don't think anyone in their right mind expected this type of summer. I don't think anyone was ready for 2020. We don't like change. We fear change a little bit here. We like to preserve our old traditions. You know, during normal times, I would say we could see anywhere from 400 to about 4,000 customers in a given day. We're obviously not seeing that these days. We're just seeing people leaving the city. We're lucky if we see 100 customers in a day now. And when people don't have money in their pockets and there's no influx of foreign cash and there's no help from the government, it's a lethal combination. If you go back all the way to the 1880s through today, in that time we've seen a different pandemic, a couple world wars, a couple depressions, a couple recessions, every imaginable world crisis. Listen, I can't speak to the world wars or the first pandemic, but I can speak to the crises that I've seen over my tenure here. This is different. You know, in my lifetime, I can't ever think of a single incident that has unilaterally impacted every single person in the world at the same time. We've been open since day one. All 200 employees are still working here. We've been able to not lay anyone off through a couple of different things, one of which is shipping throughout the country. Send a salami to your boy in the Army is our slogan since World War II. It started because the owner at that time had 3 sons serving overseas, and Grandma was just afraid they weren't eating particularly well. You know, those government rations weren't so great.
Send a salami to your boy in the Army.
And since then, we've figured out how to sell other items, pastramis and mustards and soups, knishes, latkes, and doing that has really allowed us to offset some of our losses.
For the first time in 133 years, we're doing outdoor dining.
As far as we're aware, there was no outdoor seating at any time. That includes during the first pandemic. Come over here and you order sandwiches. Because of the pandemic, we've had to create a line around and promote social distancing. And you could tell it's a little different now, right? And the screaming and the energy and the chaos when there's 300 people in the store. Now we kind of limit it to about 15, 20 customers at a time.
I mean, I'd love to sit down just because sitting here is part of the experience, just watching everyone and like seeing the tourists come in and kind of being shell-shocked. Still, everything here, the guys and everything like that, that hasn't changed.
You know, the camaraderie with the people, the connection with the public, I think that's the biggest change.
In many ways, I'm just a Jewish grandmother. I just want to feed people. And having people be able to let me do that is great. Feed the Frontlines is helping us through the orders that they're able to give us, and they're able to pay for those orders in a way that allows us to pay for the staff to keep working. You know, very early on in the pandemic, in helping to feed healthcare workers, frontline workers. If you think about our slogan, send a salami to your boy in the Army, well, you don't need to send it very far. You know, our soldiers are located 20 blocks away, you know, and they needed our help.
More and more now, as the crisis has shifted away from the hospitals, we've also been supporting Katz's in feeding New Yorkers who are increasingly food insecure. I don't think anyone really knows what's next for the restaurant industry. We want to keep giving them a lifeline and keep making sure that places like Katz's can keep their people employed.
Hopefully we'll be here another 132 years, and if some future pandemic, they'll look back at this tape and say, wow, it was exactly the same then.
I've never seen an infection like this, where it goes from 40% of the people have no symptoms at all, very heavily weighted towards young people who do really quite well, to people who have minor symptoms, moderate symptoms, severe symptoms, hospitalization, intensive care, and death. Even though you may not get any symptoms, what you're doing is that you're propagating the outbreak, and that you will almost certainly, or one of your colleagues will infect someone else, who will infect someone else, who then infects somebody who really, really gets sick. So we've got to all pull together. No question about it that if you get a vaccine, you're going to at least have several months protection to get you through a season. If it turns out that you get more than that, well, all the better. There are a number of vaccines that have already entered phase 3 trial. We don't know which one is going to be better than the other. And you know what I hope? I hope they're all equivalently good.
For this week's health segment, we're looking at the long-term impacts of the coronavirus. Australia's St. Vincent's Teaching and Research Hospital in Sydney's Darlinghurst has been studying what happens to patients who recover from COVID-19.
Anybody who needed to be hospitalised or needed intensive care support will suffer disability afterwards. There are different disease severities. And what we're studying at the moment is the patients who had mild symptoms and then the patients who had severe COVID. Anybody who has to go to ICU for a period of time, many of them get a condition called PICS, post-intensive care syndrome. And, it's characterized by weakness. Sometimes patients need rehabilitation. Fortunately, in many cases, that syndrome is reversible. If anyone's experienced complications during their stay, they may never reach their former baseline level of functioning. I expect that there will be a reasonable burden on the kind of specialties that would look after post-infectious, post-ICU patients. So we're talking about the rehab specialists, the rehab units, the physios, OTs, social workers. Speech pathologists, we often contact patients who have breathing tubes in their vocal cords. Then they can often have hoarseness for a while and we need speech paths involved. If we're talking about even short to medium term problems, it's more economic burden on the healthcare system, resource burden. It's taking patients away from their regular roles in terms of employment and roles as carers. There's a broader economic problem which follows the health problem. Even the patients who didn't need to be hospitalised, some are still complaining of symptoms 3 or 4 months down the track. And, these symptoms can be disabling for people, especially if you're in a profession where you need to be at the top of your game physiologically. The whole aim of our study is to work out why this is happening, what the impairments are, and what patients need. It's such a novel virus. There's so much that we don't know about it. There's so much we don't know about the effects of it long term. I think this is all work in progress.
Nursing homes have been some of the hardest hit places throughout this pandemic, and there's increasing calls to not only protect the elderly, but also the staff working around the clock at these facilities.
They are so silent. They're often forgotten, too easily forgotten, the elderly in general, but they're the most fragile. I think over 40% of the deaths will have happened in nursing homes. Nursing homes are places that have traditionally, fragile people. This is where COVID was the deadliest, frankly. The vast majority of nursing homes are not places where you and I would want to leave our parents. And this is not per se by fault of the people who work there, but it is because of our system that has neglected those places, that has not been funding them well, and that has chosen to let these places be places that are chronically neglected. And so you have an outbreak, huge outbreak, like a COVID-19 that hit already a chronically sick institution, and you have an acute on chronic disaster that's very deadly. It's not that these places don't have guidance, don't have guidelines, don't have protocols. They've been, in fact, inundated by these things. What they actually needed were people like us to be in the facility and to help them translate that guideline into actual simple protocol, something that you can implement. One of the most important things that we were able to do was to embed in the facility. We also did classes on infection prevention control, especially targeting clinicians, but also then we separated our classes between the non-clinical and the clinical staff, because we found that the non-clinical staffs, housekeepers, people in the kitchen, the receptionists, they're working in those places. They're working in a high-risk environment, but they don't receive the attention that the medical staff receives. The investment isn't much, but the difference is massive. We're not going to get any kind of return from these elderly folks, but that's not how we should be thinking about that and about our elderly, at least in the United States. The way we think is wrong. It's sad. It sort of says a lot about who we are as a society and what it is that we value.
Озеру, как вы видите, сейчас нанесен огромный ущерб. Структура озера Кобитуз и Теңіз, которая находится рядом, до такой степени хрупкая. Это такие хрупкие экологические системы, биологические, биохимическая структура. Она до такой степени у нас уникальна и хрупка, что даже вот буквально в июле месяце, когда приезжали люди в Москву, нанесли ущерб этим озерам, что, по мнению специалистов на данный момент, нужно 10-15 лет, чтобы эти раны зажили.
The lack of venture capital investment to Black-run businesses has drawn renewed attention. Research shows barriers such as unconscious bias restricts access to VC financing and hints at a wider problem. Joining us now to talk about this issue and more is Eric Collins, CEO of ImpactX. Eric, thank you for joining us.
Thank you, Sarah. Good to be here.
For those unfamiliar about ImpactX, tell us a bit more about the fund and areas in which you invest.
I think most people who are watching this would know that Silicon Valley is considered for the last 70 years to be sort of the epicenter of fantastic and sort of tremendous investing using venture capital. Organizations like Netflix, organizations like Amazon, organizations like Google and Facebook have all been venture-backed companies. ImpactX is bringing that tradition here to Europe. And the reason we're doing this is because there's an opportunity that we think exists, that if you look around, when I started in the United States as a entrepreneur, less than 1% of venture capital went to Black-run businesses and Black-founded businesses. That's the same thing that we're finding here in the UK, less than 1%, and then the same thing throughout Europe. And the opportunity to then invest in businesses to try and find and then to build out the next Netflix, to build out the next Apple, that's what we're trying to do. And so the way that we do that is we take money from private investors and do studies and research about who's out there doing fascinating things, what young, mid-age, or older entrepreneurs, and then we try to put money behind them in order to help their dreams to be made into a reality.
How will you advise the government to help Black-run businesses and other underrepresented groups? What would be your top 3 things?
So I'm going to give you one, and I'm going to repeat it 3 times. We need to have Black people at the table having a conversation about what are the solutions that are going to be necessary and are going to actually make sense. I'll repeat that. We need to have Black people at the table. And I'm going to say as my number 3, Sarah, we need to have Black people at the table. If you do not have the representation, if you don't have the voices and those sort of experiences that are going to help to frame the conversation and then also create and generate the solution set, you're going to get solutions that are not fit for purpose. And I think this is continuing to happen time and time again. Someone's being invited to the table to have conversations. Someone is being asked, does this make sense? But obviously there is a gap which exists, and that gap can be filled and needs to be filled immediately with real information.
The future entrepreneurs will be born from this crisis. So I was wondering, from your many decades of experience, if you could give any advice to aspiring entrepreneurs.
I'd say the big advice I have is you have to survive in order to thrive. So you have got to survive this period. To the extent that you need to extend your amount of cash on hand in order to be able to pay your employees, in order to be able to keep the lights on, you need to do that and focus on that first. And then you need to, having done that, you need to analyze what the future, you believe the future is going to look like. That's a hypothesis. So make a hypothesis as to what the future will look like. And then from that hypothesis, then design what your business needs to do in order to be able to thrive in this new world. You want to do as much analysis as you can as quickly as possible. And then you want to make sure that you're then moving into this new world and the world where you can thrive as quickly as you can. And I think many organizations sit hoping that the world will go back to the way that it was, which I don't think it ever does.
Eric Collins, CEO of Impact X, thank you very much for joining us.
All right, that's our show for this week. Remember to follow Bloomberg QuickTake on Twitter, Facebook, Instagram, and YouTube.
And for a daily recap of the day's top stories, visit www.quicktake.video. Thanks for watching.